Hello again, everyone. Welcome to Fayette Regional Health Talk. I'm Tammy Dowd.
And I'm Doug Fischesser. Thank you for joining us. As always, Health Talk is made possible by TV3 and Fayette Regional Health System, so viewers in the Whitewater Valley can be better informed of the health and wellness topics and opportunities in your area.
That's right, Doug. And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk News is the announcement that Fayette Regional Health System has extended hours for immediate care at the Fayette Regional Primary Care Center. Dr. Ryan Minnick, Gary Metcalf, and Jessica Duyard, along with 5 nurse practitioners, now allow Fayette Regional Primary Care Center to offer full staff for your immediate care needs 7 days a week. Walk-ins are welcome Monday through Friday and even on the weekends for adults, seniors, and kids too.
As part of Fayette Regional's continuing efforts in the community outreach, we are providing monthly screenings and activities as well as participating or hosting several events in and around Fayette County. The first Monday each month, Fayette Regional joins AARP at the Fayette County Senior Center providing valuable information and education. The first Tuesday each month, Southview Courts in Liberty, Indiana hosts Fayette Regional. Blood pressure and blood sugar screenings are provided along with education and activities.
The first Wednesday of the month, Fayette Regional will be at Fountain Place Apartments in Connersville to provide education activities beginning at 2 o'clock. To round out week 1 of each month, Fayette Regional Care Pavilion and Jerry Sykes Services host a Caregivers Relaxation Lunch. This is the first Friday of each month. Caring for persons with chronic illness is a rewarding endeavor, but oftentimes place extreme demands on the caregiver, who can sometimes become overwhelmed trying to balance work, family, and caregiving. These demands can result in the neglect of their well-being. We are pleased to offer this Caregivers Relaxation Luncheon as a time of respite for caregivers to refresh mind, body, and spirit and learn ways of taking care of themselves. Call 765-827-8022 for more information or to make your reservation.
Continuing on the second Tuesday of each month, Fayette Regional offers a free lunch and learn to area seniors at the Fayette County Senior Center. This monthly event is always well attended and free health screenings are offered. Our presentation begins at 11 a.m. and lunch will be served at 11:30 a.m. If you wish to attend, please make your reservation by calling the Fayette County Senior Center. Fayette Regional is also at the Franklin County Senior Center at 9 a.m. the second Tuesday of each month, again providing education, activities, and health screenings.
Fayette Regional staff and community alike raise their sleeves throughout the year to give the gift of life. Last year, over 60 units of blood were donated, helping supply over 60 hospitals in Indiana. Please join us by supporting these blood drives. Go to FayetteRegional.org for a full listing of blood drive dates. We look forward to seeing you at all of these events. When we return, our guests will be in studio to tell us about an improved health plan for the state of Indiana. HIP 2.0 is here, and Fayette Regional can help area residents get enrolled. It's a great plan allowing more people to get health insurance. And we'll be right back.
Welcome back. Joining us now is Tricia Blevins from ClaimAid. Thanks for joining us, Tricia.
Thank you for having me.
Tricia is our local expert regarding the new Healthy Indiana plan, which is known as HIP 2.0. She's here to help us all better understand this improved program. Thanks for joining us today. Can you start off by telling a little bit about yourself?
Well, I'm originally from Newcastle, and I'm still living there. I've worked for Fayette Regional now for 4 years. My husband was a former Vistion worker, and so I understand a little bit about Connorsville and what's happened to Connorsville. I've been with ClaimAid for 5 years, and so I'm happy to work for them.
Well, great. Good to have you. Well, let's start there. What is ClaimAid, and what does it do for Fayette Regional?
ClaimAid is a company that's been in business for 25 years, and they're in 20% of the hospitals throughout the state of Indiana. And hospitals hire them, and what they do is help people get on disability, Medicaid, or HIP. And what they do is help financial aid, things like that, people that don't have insurance.
Well, let's go ahead and start with the HIP 2.0. Can you explain to us what exactly is HIP 2.0?
HIP 2.0 is a program that Governor Pence started, and what it does is it helps people that does not qualify possibly for Medicaid or makes too little to qualify for Obamacare or the affordable marketplace to be able to get insurance.
Okay, and so what's different about this new HIP 2.0 versus the old original HIP?
The good thing about this one is that it provides dental and vision, which the other one does not.
Okay.
You know, and a lot of people were desperately in need of dental. And it holds people more responsible. Everyone has to pay on this one. So everyone, regardless of income, has to pay $1. It ups the power account contributions from $1,000 up to $2,500. So there's some, or $1,100 up to $2,500. So there's a few differences. Even if you may not recognize it, there's a little bit of differences.
Tricia, what health care coverage does HIP 2.0 offer?
You get full medical coverage, as I said before, the dental and the vision. There's acupuncture is even covered with it. There's a lot of different things you can get. There is transportation if you have HIP plus. You can get 10 round-trip transportation visits with it. Pretty much any full medical coverage that you need will be covered with this.
I see. This isn't Medicaid, so give us a little idea what the difference in the two.
Well, it is a lot like Medicaid. The difference is you do have to be accountable for it. You have to pay, as I said, the $1. So there is some accountability there. One of the differences is with Medicaid, you were responsible for a $3 prescription. With HIP, your prescriptions are covered by this power account. Another difference is they will put you in a work program if you'd like, where with Medicaid, they did not do that. So there is some accountability that way. You do not have to sign up for the work program, but if you want to, you can. So those are some of the, the two major differences to it. But as for the coverages are pretty much the same. Medicaid looks at your resource limits. This does not look at any resource limits. It doesn't matter what you have in the bank. It doesn't matter if you have stocks, bonds, 401ks, how many vehicles you have. This only looks at how much you have per month. Also, Medicaid goes by what you do earn per month, and there is a lot less that you can earn per month with Medicaid than what you can earn on this. So a lot of people who were kicked off of Medicaid because of their monthly earnings can get on HIP.
Okay.
So,
and are there different levels of coverage with HIP?
There is a HIP basic program, and those are for the people who are earning less than 100% of the federal poverty level, or $980 a month. If you do not make your power account contributions, or this $1 a month, you are on the HIP basic program. you really don't want to be on the HIP basic program. It's nothing bad about it, but you do have to pay $4 copays. You also have to pay $4 prescription, where if you do make your $1 a month contribution, you do not have to pay that. So if you go to the doctor one time a month and he writes you 2 prescriptions, you're looking at $12. Where if you know, make your Power account contribution, you know, every month, you know, there's your $12. So, and you get dental and vision. Where you do not with the HIP basic. So you want to make your Power account contributions.
Okay.
I see.
And are there different agencies then within this program, within HIP 2.0, or?
There's not different agencies, but there's called managed care entities, MCEs, and you'll hear a lot about those. And these kind of confuse everybody, and everybody wants to know which one is best. And there's really not one that's better than the other. They all cover the same things. But it's Anthem, MDYs, and MHS, or Managed Health Services. And the only difference is, what does your doctor choose? Some doctors may only take Anthem. Some doctors may only take Managed Health Services. We're fortunate here at Fayette that our doctors accept all of them.
Okay.
So it just is a preference. You know, if your doctor accepts all of them, it's just a preference of what you might want.
Okay.
You mentioned the HIP Power accounts a little bit earlier, and explain a little more about these. What are the contribution amounts, and what are the benefits of timely contributions?
HIP Power accounts are basically a health savings account. And when you make your copays every month, your Power account contributions every month, it goes into this. So you pay $20 a month, and it's going to go into this. The state is going to fund the rest of this. And with this, it's going to pay for any prescriptions you might have. At the end of the year, you have a surplus. If you do everything you're supposed to, if you get your physicals or whatever, your flu shots, whatever. If you have a surplus left over, then the following year, your premiums are going to be cut in half, or you may not even have to pay premiums the following year. So there is some good things about this. Now, if you go over and you use up all your Power account, you know, they're not going to say, okay, now you're not going to be able to get services. The state's going to fund those to you. So if you've been really sick and you've had to use all your Power accounts, you're not going to be responsible for that. So
the state's kind of wanting to make Indiana's citizens more accountable for their preventative health care. And giving them incentives by managing those costs. And
if you do have, say, mammograms, for instance, if a woman has her mammogram, there's going to be a $500 cost that they give you to have all those. That does not count towards your Power account. So all of those do not count towards that. So, you know, for your flu shots, your mammograms, your prostate exams, things like that, that you can go and have done. But yet the state, you know, gives you credit for that. And so then the following year, as long as you have these things done, then they will give you back credit towards your premiums.
Okay. And so who is eligible then?
Anybody between the ages of 19 and 64 are eligible for this program.
Okay.
You have to make, like, a single person they can have health insurance. This can be a secondary. This doesn't necessarily have to be their first insurance. If you have high premiums, things like that, you can sign up for this. If you make less than $13.64 and you're single, you're more than welcome to sign up for this. If you are a couple that makes less than $18.40 a month, you can sign up for it. As I said, whether this be your first insurance, your secondary insurance, whichever. You cannot have Medicare. That is the only other thing that you cannot have. It cannot be your secondary with Medicare.
Okay. And so how would someone enroll in the program?
There are several ways you can enroll. You can come to my office. We can enroll you that way. You can call me. You can go to the local Medicaid office at 1501 Eastern Avenue. They can help you enroll. You can do it online at indiana.gov, in.gov, and you can enroll that way.
Okay.
If you are in the middle of enrolling, you're having trouble, you can call me and I can help you through the steps that way as well.
Well, great. Well, thanks for coming in today, Tricia. It's very valuable information. We've learned a lot. We appreciate it.
All right, thank you.
Thank you.
Jerry Sykes Services is a medically managed, short-term inpatient unit for seniors 65 years of age and older, available 24 hours a day, 7 days a week. Please join me for a closer look at the new Fayette Regional Jerry Sykes Services.
Welcome back. It's time to shift gears a bit and talk to a special guest from one of our community partners. We would like to welcome Krista Gibson from Heritage House Healthcare Center here in Connorsville.
Thank you.
Krista, can you tell us a little bit about yourself and what's your role at Heritage House?
I'm born and raised in Connorsville. My role is Director of Admissions and Marketing there. I market the facility and take care of all the admissions that come into the building.
Okay.
What type of services do Heritage House offer, Krista?
We offer long-term services, rehab to home, respite, hospice care there. We also have what we call our Augustus Memory Care Center, and that's our cottage for dementia and Alzheimer's residents.
I see. Does insurance cover these types of services, your services?
Yes, we take most basic insurance. We take Medicare, Medicaid. We also take managed care insurance, for instance, Blue Cross, Humana. Most managed care insurance, you don't need that 3-day hospital stay that Medicare usually requires, so that's a good thing also.
I see.
And you mentioned Augustus Memory Center. Can you tell us a little bit more about this? I know it's a specialty portion there at Heritage House. Can you give us some more information about that?
Yes, it's a 24-bed center there, and it specializes in the memory care for dementia and Alzheimer's residents there. We are actually in the process of renovating that center right now. We have memory care boxes that align the hallways by the residents' rooms, so it kind of helps with their cognitive memory, so they know where their room is at. We do activities daily in that center there. It's a secured location, so if a person is used to wandering out, the family member can know that they are safe and secure in that unit.
And can someone that might be interested, can they tour? You offer tours at the
Yes, we offer tours 24/7. Anyone that works in our building is able to take a tour, so
Okay.
we encourage anybody to come out and tour anytime.
And how many rooms, how many beds?
We are a 96-bed facility, a 5-star facility there, but we have 24 beds in our cottage, and we have 10 beds on our rehab to home unit. So,
Great, okay. Krista, I know you always have something exciting going on out at Heritage House. Give us an idea of some of the upcoming events that you have.
we have Alzheimer's support groups for family members. We do that every third Thursday of the month at our building at 5 o'clock. We also have a purse bingo that's coming up. It'll be held on June the 26th at the Miller Building at 6 o'clock. And the tickets will go on sale the 1st of May. They're $15. All the proceeds will go to the Walk for Alzheimer's Association that's held in Richmond, Indiana.
So purse bingo.
Yes.
Give us an idea. What's purse bingo?
You pay $15 to play bingo. If you hit a bingo, then you win a purse, a handbag. So, yes.
I understand you have some designer bags.
Yes, we do.
Okay.
We have a lot of local businesses that have donated handbags. The hospitals donated a handbag. But yeah, there's a lot of nice designer ones there.
And this is open to the community, so
Yes,
anyone
it
is
is.
welcome to attend.
Anybody
Okay.
is welcome.
Awesome. Great.
Great. Sounds like fun. Well, Krista, thanks for joining us today. Be sure to tell all your friends about your television debut.
Thank you.
Thanks, Krista. We'll be right back.
Fayette Regional Mental Health Minute.
Does your child have a hard time sitting still, even for a short time? Is he easily distracted? Does she say or do things without thinking? Do his behaviors prevent him from succeeding in school, at home, or with friends? He might have ADHD or attention deficit hyperactivity disorder, a common and highly treatable condition. It's estimated that 3 to 7% of children have ADHD. If you think your child may be one of them, get help from your pediatrician, school psychologist, or mental health professional. They can tell you if your child has ADHD and what you can do about it. For more information, contact Fayette Regional Care Pavilion at 765-827-7890. There is help, there is hope.
Doug, let's talk a little bit about what you've had going on this year with Foundation and some of the events that you've already had and the gala specifically. Let's start with that.
Well, we have two major fundraisers a year. First is the gala. We put on the gala back Saturday, March 7th, at the Expo Hall, and this was our 13th annual gala, and we did a little play on the Oscars this year. So we had the red carpet theme, and we had about 200 people attend, and basically it was very, very successful. The purpose of the gala obviously is to raise money, but we also want to thank some of our sponsors, the people, our suppliers that we do business with at the hospital, and obviously our donors. And the gala used to be, we used to put it on in Indianapolis. We brought it back to the community about 5 years ago. Obviously, we're a community hospital, and we thought it's a little much to ask for people to maybe spend a couple days, come up. It was fun in Indianapolis, and we had some very successful galas there. But we wanted to do some things give back to the community, and so it's been very successful the last 5 years. So the last 3 years we've done a sort of a themed part for the gala, and like I said, this year we had a little theme about the Oscars.
I understand celebrities actually did show up.
A few celebrities did, and we've got pictures to verify that. But we set the red carpet out, and just like the Oscars, like we do on the TV, we took pictures, and we had the sponsors displayed on the background with the two big golden statues. So we had some Oscar winners that night. So
it was a great time. I know a lot of people look forward to that event each year. It's something different, something that we don't have in Connersville, and just is a time for us to get dressed up and go to a formal event. So it's a nice time.
It gives people a chance to dress up. We had a great meal. Bob Heil from Hometown Caterers did a great job for us. And we have a wonderful band called Endless Summer. They've performed for us for about 7 years. Very, very popular. They do a great job. Put on a great show. So it runs from 6 to midnight. So everybody gets a big bang for their buck.
A good time. So what's next? I know spring is here, and that usually means everybody's out on the golf course.
Finally, the weather's getting a lot better, and so our second big fundraiser of the year is actually this year it's going to be the 35th annual golf outing. As I always tell people, it's the most popular golf outing in the area, and it will be August 29th at Willowbrook Country Club. We normally have about 200 players, and again, we reach out to our vendors and sponsors and our donors, and we have 2 sessions. We have a 7:30 session in the morning. Usually we have about 100 players, and a 1:30 session in the afternoon. Gets about the same. So we try to it's a long day, but we fit about 200, a little over 200 players. So, and again, we have a lot of donors and suppliers and people like that donate prizes, donate food and things like that. So it's a fun day. It's a long day, but it's a fun one.
Well, and I've heard many comments that it's the best, the most well-run golf tournament, at least in this area. So
we take pride in our golf outings. That's for sure.
It's a good day. It is a long day, but it's a good day.
It is.
April, Volunteer Month. What do we have going on for Volunteer Month?
Well, I am the director over the volunteers at the hospital. We have about 75 active volunteers.
Okay.
April is National Volunteer Month, so every April we put on a sort of a spring luncheon for our volunteers. It's going to be next Wednesday, April 22nd at the Miller Building. And it's just a chance for us to thank our volunteers for what they do for us every day. They do a lot of things every day for the hospital. They man our information desks, the ER desks. They do shredding. They deliver mail. They deliver flowers. And they just do a fantastic job for us. And they volunteer over 12,000 hours a year to the hospital. Over the last 30 some years, they've done over 350,000 hours of volunteer work. So
That's
obviously we're very thankful for the time and effort that they put in, and they help us do a lot.
Well, good. Well, we do appreciate our volunteers, and that's all the time we have today. We look forward to everyone joining us next time on Fayette Regional's Health Talk. I'm Tammy Dowd.
And I'm Doug Fischesser. Stay healthy, Connersville.